So, what is the rebound effect of GLP-1 receptor agonist? And these are medications like Mounjaro or Zempic, which are used for weight loss and diabetes and become quite common in women in reproductive age. And why are they effective? They're effective because they reduce appetites, slow stomach emptying, and improve insulin function. They're not approved for use in pregnancy, so they must be stopped as pregnancy is recognized. This raises questions. What happens to weight gain and pregnancy risks after stopping these risks near conception? So, a recent study set out to answer this. Researchers compared pregnancies in women who had used GLP-1 drug and stopped it before or in early pregnancy with pregnancies in similar women, similar body size, health conditions, who never used GLP 1s. They looked at total gestational weight gain and several important outcomes: preterm delivery, gestational diabetes, and hypertensive disorders of pregnancy. The results were, in fact, quite striking. First, women who had used the GLP-1 and then stopped gained, on an average, 3.3 kilogram more during pregnancy than women who had never used these drugs. Many also exceeded gestational weight gain targets. And secondly, many pregnancy complications were more common in the prior GLP-1 group. Preterm birth occurred in 17% of pregnancies compared to 13% in the unexposed group. Gestational diabetes affected 20% in the GLP-1 versus 15% of controls. Hypertensive disorders of pregnancy were particularly frequent: 46% of women who had stopped the GLP-1 versus 36% of the unexposed. In contrast, there were no major differences in the cesarean section rates of babies being very small or large, though birth weight percentile was slightly higher in the GLP-1 group, suggesting that the strongest effect is on maternal cardiometabolic health rather than extremes of fetal growth. Now, why would this happen? One possible explanation is a rebound after stopping treatment. While on GNP, weight gain and metabolic markers are better controlled, when medication is stopped, often abruptly because of pregnancy, appetite and weight gain can rebound, and blood pressure and blood sugar markers may get worse. Pregnancy itself is quite a stressful condition to the system, so the rebound may push some women into gestational diabetes and hypertensive disorders. Remember, it's an observational study, so it cannot prove whether stopping GLP-1 is directly a cause of these complications. And one of the things to remember is women who have been on GLP-1, whenever they fall pregnant, it's important to remember that their rebound weight gain and complications may be on the rise, and closer evaluation may be recommended.